blood pressure is the pressure created by the heart as it pumps blood through the arteries and the circulatory system of the body.
Open eye.
Hi, you're welcome to my channel. Thanks for tuning in. Today I'm going to be talking on hypertension and how hypertension can be managed. So first, what is hypertension? Hypertension is sustained elevated blood pressure. And what is blood pressure? Blood pressure is the pressure created by the heart as it pumps blood through the arteries and circulatory system of the body. So if we are having a blood pressure of greater or equals to 140/90, the upper being 140 and the lower being 90, and in some cases it could be that the upper will be high and the lower value will be normal, or the upper value will be normal and the lower value will be high, is still hypertension, because it's what we call isolated systolic hypertension or isolated diastolic hypertension. So if you are getting higher values, we are talking of hypertension. So we have the primary type of hypertension and the secondary type. So primary hypertension is due to genetic and environmental factors, while secondary hypertension is due to underlying diseases. So for example, if we are talking about primary hypertension, we can cite an example of someone who takes excessive salt, someone who is genetically susceptible to hypertension and is taking excessive salt. That's an example of primary hypertension. So secondary hypertension, there are different kinds of secondary hypertension, like chronic kidney disease, pheochromocytoma, Crohn's disease, Cushing syndrome. There are examples, diabetes. There are examples of secondary hypertension. There are other causes too that we can put under secondary hypertension. So what are the symptoms of hypertension? Hypertension itself might not present with any signs or any symptoms. It might not present. That's why it's very good for you to check your blood pressure often. It might not show you any symptoms, it might not show you any sign, but if it's hypertension due to an underlying disease, it might show you the signs and symptoms of that particular disease that is causing the hypertension. So that's why it's very good for you to always get your blood pressure checked. Okay, so what are the other causes of some other things that can cause hypertension that we can put under the secondary type of hypertension? Like excessive alcohol intake can lead to hypertension. Obesity can lead to hypertension. They can lead to hypertension. So you have to be careful, you have to watch your weight. We are still going to talk about that later in this video. Okay, so what are the complications of hypertension? There are some complications that come with hypertension if it's not well managed, like stroke, kidney failure, heart failure, what we call aneurysm. They can be complications of hypertension. That is why it's good to always get your BP checked. It can't be overemphasized. Get your BP checked, get your blood pressure checked, so that you won't have all these complications that are life-threatening. Okay, so how can hypertension be managed? How can hypertension be managed? First is lifestyle changes. Are you living a sedentary lifestyle? You have to exercise. At least you should exercise at least 5 times in a week, at least 30 minutes each day. You should exercise at least 5 times in a week, at least 30 minutes each day. It is very important for you to know that. And if you are obese, you have to reduce your weight. It is very important you also know that. And also, if you are taking excessive salt, you have to reduce it. If you are taking excessive alcohol, you have to put a stop to it. If you are smoking, you have to stop. It is very important. Okay, and there are some drugs, there are some medications that you take for hypertension. I'm not going to mention them here because it's very important that go to the hospital and see a doctor before you start using drugs. Don't just say that because someone else is using a particular antihypertensive and you want to use it. It's not done that way, because these drugs come with their contraindications. drugs have their contraindications. There are some drugs that you in particular should not use, even though they are working for the disease you have. You shouldn't use those drugs. They have their contraindications, and your doctor will clear you, will ask you some questions. Your doctor will know about your health, and your doctor will be able to tell you that this particular antihypertensive is good for you, and this particular antihypertensive is not good for you. And even after your doctor have placed you on a particular medication or some medications, you still have to be going for checkups. You still have to be going to your doctor. You still have to be going to the hospital, so that they'll be checking it and know when to increase your dose or to reduce your dose or to maintain it or to change your drug. It's very, very important to know that. And I pray that God will help us in Jesus' name. If you have any question, you can drop it in the comment section and it will be addressed. Thank you very much for watching. God bless you. See you in my next video. Bye bye.